Hello everyone and welcome to Mtoto News. I am Anlin Barbara. For a long time, institutionalization of children in orphanages and other care institutions was a major part of child social welfare services. Institutions were viewed as a place of refuge where vulnerable children could get the help they needed. According to Lumos, 8 million children across the world live in orphanages, and yet 80% of them are not orphans. This means these children are not living to achieve their potential, or they are at risk of being trafficked, and hence the Empty the Orphanages movement. The movement has seen countries like Rwanda close orphanages and reunite the children to their parents. While the movement has been criticized of demonizing institutions, of being a fad and not having a backup plan for children with no families, the Kenyan government is joining the movement. Through the Department of Children's Services, the government brought together stakeholders in the alternative child care sector to discuss the roadmap to start the deinstitutionalization of children.
In the abandoned baby unit, for example, young babies, they're crying, no one to give them attention. And even with the experience that I have now, because I still go back to the home, my experience is that when you lift up that child, it's a big risk, because when you put them down, they will still be crying because you've let them go and they're not used to that. And so my challenge to us today is, as we look at this job of the whole deinstitutionalization agenda, we need to ask ourselves a very key question. What do children really need?
It was revealed that there were over 820 registered charitable children institutions in Kenya with over 45,000 children. It was, however, noted this number could be higher than that because there are many institutions that are not registered and hence not in the government database. There are 29 statutory children institutions with a total of 2,900 children, which according to Department of Children's Service is a great improvement considering less than 10 years ago, one institution used to have an average of 250 children. It has been close to a month since the August 8th presidential election. A lot of people do not know what will happen during the repeat of the election. We are waiting to see what's next. Everything is about politics right now, and so much has been disrupted only a few days to elections. The momentum of campaigns has picked up, and in Central Business District, people have been gathering for demonstrations. But something that has not quite been taken into consideration is protecting children and to ensure that nothing much affects them. Following the August election, one child was shot dead by a stray bullet and a 6-year-old slipped into a coma as a result of excessive force used by police. Election violence brings with it the potential for psychosocial damage in children and can be dangerous on their development. Protection of children is critical for their overall well-being, and every child should be protected during this election period. The Global Hand Washing Day is a global advocacy day dedicated to increasing awareness and understanding about the importance of hand washing with soap as an effective and affordable way to prevent diseases and save lives. Celebrated annually on October 15th, Global Hand Washing Day is an opportunity to design, test, and come up with creative ways to encourage people to wash their hands with soap. The 2017 Global Hand Washing Day theme is Our Hands, Our Future. This theme reminds us that hand washing protects our own health as well as those of children. More than 200 million children fail to reach their full potential because of poor hygiene. Children who do not properly wash their hands before meals and after going to the toilet are at risk for diarrhea and other diseases related to poor hygiene. However, proper hand washing can lead to better growth and development for children. No matter what your role is, you can celebrate Global Hand Washing Day by learning more about why hand washing has a positive health effect in children. The attack that took place in Lokichogyo last week left 5 students and 1 security guard dead in a secondary school. The attack was planned by a student who is said to have been suspended. He was suspended by the head teacher after being involved in a school fight and came back in retaliation to the head teacher. It was also claimed that he sexually assaulted 2 girls and injured another 18 girls with his accomplices. The student attacker further stated to fellow students he will torch the school as revenge for the suspension. This raises question on indiscipline and insecurity among children. The examination period is also around the corner, and a situation like this is likely to cause tension among students in the area. Education Principal Secretary Belio Kipsang has, however, assured students in the school that exams will not be interrupted.
Our security team are ensuring that those who committed this particular heinous act are apprehended, and that they should be able to face the full force of the law. Again, I would want to assure our children that they will be able to do the exam in an environment that is conducive to them.
In the last several days, we have seen how malaria virus has caused such a stir in the country, coming at the wrong time when nurses in the public health sectors have striked. Not only has it killed the elderly, but also the number of children dying is increasing. 5 children were recorded dead while others have flooded the hospital wards. Also, a huge number of women have died while giving birth. According to a report by Malaria Intervention, the disease kills 1 child every 30 seconds in the world. But the number increases in Africa. 1 in every 5 deaths of a child dies of malaria virus. The World Health Organization notes that parents should be on high alert on noticing any of these signs and symptoms of the disease, such as high fever, nausea, vomiting, chills, and sometimes diarrhea. Though the county governments are responsible on the healthcare system in their counties, the government, on the other hand, has a major role in ensuring that every Kenyan child has access to health as accorded by the Constitution. With only 9 days remaining to the repeat of presidential elections, are we sure that our children will be safe during this period? At Mtoto News, we really take care of that young person. Let them not be used during the process of campaign, elections, or any other thing. Join us at Mtoto News on Twitter, Facebook, Instagram, and YouTube. I am Anlin Barbara. God bless.